The new law means more people can be involuntarily treated or put into a conservatorship. Senate Bill 43 expands the definition of gravely disabled to include those with a severe substance abuse disorder who cannot provide for their own safety or medical care. That expansion is set to take effect in January, but counties can opt to delay implementation, something County Board Chair Nora Vargas is proposing with support from local hospitals.
Reason is pretty simple. We do not have the facilities.
Vargas says the county is committed to implementing the involuntary treatment expansion, but wants to wait until 2025 to do so, pointing to the rollout of Care Court and the process of involving stakeholders for a successful implementation.
The year really gives this county time to plan and prepare and coordinate so that we all know what we're going to be doing and how we're going to manage this. Remember, this law is supposed to go into effect in less than a month now, and nobody's had any discussion on coordination and how we're going to do that.
The Hospital Association of San Diego and Imperial County says if SB 43 goes into effect on January 1st, there will be insufficient services in place for people who are deemed to meet new requirements of gravely disabled. San Diego Mayor Todd Gloria says there's too much at stake to delay implementation for another year. He argues lives could be lost.
And I believe that this is one of the key ways that we can get some of the most difficult cases. I'm not talking about folks who lost a job or who are just struggling to make the rent. I'm talking about people who have severe mental illness, bipolar, schizophrenia, and often co-occurring situations of extreme substance use disorder around methamphetamine and fentanyl. That's why I say this could result in more people dying.
Well, I'm concerned that it might cost people's lives because we don't have emergency rooms, that they'll be full of patients. We're supportive of what the mayor would like to accomplish, but we're also worried about, our capability and capacity to be able to do this safely for them and for other patients.
Van Gorder says hospital emergency rooms are already extremely busy, but Gloria says any change at this point is better than the status quo.
If we leave things the way that they are, the people who will be left to serve this vulnerable population is law enforcement, is our shelter providers, and probably most tragically, the elderly aged parents of adult-aged individuals who have severe mental illness.
San Diego County Sheriff Kelly Martinez supports the late implementation because she says the proper training and infrastructure needs to be in place. Martinez says the law requires a diagnosis of severe substance use disorder, and there's no system for law enforcement to currently verify that diagnosis. Matt Hoffman, KPBS News.